A question, Miss Terry. If there was a contest today for the presidency of the United States, would Obama beat Mitt Romney?
Oh, I don't think so. Keep the change.
I've got poll numbers which may prove you wrong.
Really?
Yes. In addition, we've got a great studio audience with us. Hundreds of partners from 32 states are joining us for today's exciting broadcast. Give yourselves a hand. We're glad to see you. Marvelous.
I want to say, Pat, that this amazing group of people is here for one reason and one reason only, and that is to wish you a happy 80th birthday.
Man, all right.
Yes, sirree.
Thank you, thank you.
But I also want to say that the fact that they're here because they love you and want to wish you a happy birthday does not mean they're going to go easy on you. We are going to have a live Q&A time with our audience later on today's show, and you don't want to miss it.
Well, as long as they're over 14, it's okay. If they're under 14, I'm scared of them. Okay. But first in the news, the battle over health care is more intense than ever. Republicans say the expensive bill will hurt the economy. But some Democrats say the bill gives coverage to those who need it. And as Jennifer Wishon reports, there are others who just haven't made up their mind yet.
A handful of Democrats remain skeptical, skittish, or both, and that's intensifying lobbying efforts by Democratic leaders.
We will make history and we will make progress by passing this legislation.
As Democrats work to organize their members, Republicans in the House and Senate are proceeding in lockstep opposition to the bill.
They're still going to spend $1 trillion to impose government-run health care on the American people. The American people want no part of it.
The Congressional Budget Office estimates the bill will cost $940 billion over 10 years. But a Senate report from last summer points to the federal government's poor track record on cost projections. When Medicare was created in 1965, Congress estimated the hospital insurance plan would cost about $9 billion a year by 1990. But actual spending in 1990 was $67 billion. Even adjusted for inflation, the program still cost 165% more than estimated. Conservatives are balking at tax hikes included in the plan, including a 3.8% tax on investment incomes earned by individuals earning more than $200,000 or couples earning $250,000. The plan also calls for fines on businesses who don't offer health insurance for their employees. It requires individuals to purchase insurance, a rule the IRS would be responsible for enforcing, forcing the agency to find out if people have enough health care coverage. And if Democrats choose to use the deem and pass procedure, which lets members avoid casting a vote on the substance of the bill, attorneys general in several states are lining up to sue. Legal scholars question whether deem and pass is constitutional, since the Supreme Court has declared the House and Senate must pass precisely the same text before a bill can become law. While the debate intensifies in Washington, Americans are getting louder too.
Health care! When? Now! People think the government is the answer. The government is the problem.
Meanwhile, House leaders are waiting on a letter of support from Senate Democrats that guarantees they'll pass the package of changes the House is proposing. House leaders hope that will help reassure their members who fear they could be left out to dry if the Senate doesn't approve the House plan. Jennifer Wishon, CBN News, Washington.
Thanks, Jennifer. A madness has taken over Congress. A madness.
What do you think's going to happen?
Well, I hate to think it, but I believe the House is going to pass something. But by the time it hits the Senate, the Constitution says it's got to be identical bills. And there is no way the senators are going to, for example, they didn't want any abortion language. I don't know what's in the House bill because I haven't read it. Nobody else has either. But the thing of it is the 3.8% tax. You haven't heard much about that. They're going to tax rents, royalties, dividends, capital gains, everything from investments for people. And again, this is small business. They're going to hit on the people who own small businesses. They're going after the people who create wealth in our society.
And jobs.
And jobs. Yeah. And then they wonder why they don't have jobs. And they pass a big job bill, but the people who create the jobs, they're taking the money away from. So, oh, man. Well, we'll see. They're going to vote, we understand, on Sunday, and we'll see what happens. Lee Webb has the rest of our top stories from the CBN newsroom. Lee?
Pat, Secretary of State Hillary Clinton is planning to meet with Israeli Prime Minister Benjamin Netanyahu next week. The U.S. wants Israel to cancel plans for new construction in East Jerusalem. Israel's announcement, of course, of that building project delayed peace talks with the Palestinians and created quite a diplomatic dust-up last week with the U.S. International diplomats, including Secretary Clinton, want those talks to resume. Pat, do you think they're going to go anywhere?
No, they can't. Because the Palestinians, in their hearts, Hamas wants the destruction of Israel. And like it or not, that's the way it is. And they are quibbling over stuff. I mean, Jerusalem is the capital of Israel. Who are we to tell them they can't build 1,700 apartments? This is insanity. And for Hillary Clinton to get her back up on this thing is just insane. And to tell it, well, you've got to stop building in your own capital. Tell the United States we can't build in Washington, D.C. and see how far that gets. Lee?
Pat, Chinese officials are heading to Washington to defend against accusations that China is keeping its currency artificially low. Some economists say China has artificially devalued its currency by as much as 40%. U.S. manufacturers complain that gives China an unfair trade advantage by making its products cheaper. American lawmakers want President Obama to formally name China as a currency manipulator. That would open the door for trade sanctions. The problem of childhood obesity is much worse than experts thought. A new study in the Journal of Pediatrics says 1 child in 5 is obese, and extreme obesity is rising among people of all races and ages in the U.S. Doctors warn that without major lifestyle changes, children today face a 10 to 20-year shorter lifespan. They will also develop health problems in their 20s that usually don't begin to show up until they're 40 or older, Pat.
These little children under 2 years old are in the hands of their parents. I mean, these kids can't toddle down to McDonald's and order a Big Mac and fries. They can't do it. Their parents have to feed them this stuff. And so you say to the parents, don't you understand what you're doing to your kids? And the answer is apparently they either they don't know or they don't care. It's shocking. And you get a little child, I want a Happy Meal, Daddy, and he starts screaming. Well, you can't have one. Eat your carrots.
I think it all... Okay, Daddy. It all starts with convenience, I think. That's the big issue for people.
Well,
it's fast.
They're going to destroy their children in the name of convenience. That's not a good thing. Lee?
The weak economy and the battle over health care are taking their toll on President Obama and Congress. The president's approval rating is down to 46% in Gallup's latest tracking poll, the lowest of his presidency. His disapproval rating is 48%. And the president is tied. You were talking about this earlier, Pat. He's tied with Republican Mitt Romney in a new survey from a polling company that works with the Democratic Party. Mr. Obama leads Mike Huckabee by only 2 points at 46 to 44%. And Gallup shows Congress isn't doing well either. Only 16% approve and 80% disapprove. Pat?
The movement is get out of our house. And I think there's going to be an incredible... Yeah, I think this audience goes along. There's an anti-incumbency mood that's sweeping the country, and it's building steam. It's not getting any better. But as they continue bringing these things like this health care bill to the American people don't want, and they say, we're going to jam it down your throat whether you like it or not. That's the prescription for losing all their seats.
It may be the first hospital to treat young people addicted to technology. British doctors have opened a clinic in central London for what they've dubbed screenagers. That's children and teens who can't pull themselves away from the internet, video games, and cell phones. The clinic will provide inpatient care or group therapy for ages 12 through 17. Operation Blessing is providing food and relief supplies to local ministries in cities around the world. Operation Blessing has 4 distribution centers here in the U.S., 1 in California, 1 in Florida, and 2 in Virginia. This week, more than 30 ministry partners came to the warehouse in Chesapeake, Virginia. Operation Blessing distributed nearly 70,000 pounds of food and other relief items. One person said the need is great because many people can't afford food as well as housing and utilities. And he said if Operation Blessing wasn't giving them the food, people would lose their homes. You can always get the latest from CBN News by going to our website at cbn.com.